Picture this. You recently come down with the annual flu. Go to your local clinic to get your flu shot. While you're there, the nurse walks into the room, introduces themselves, and eventually gives you the shot. But wait, she didn't wash her hands, and you didn't even notice. In a world where the population is ever growing, it is easy to see the spread of disease globally. But what if the spread of those diseases can be contained more effectively? Moreover, the spread of infection doesn't even need to be analyzed through a scope as large as a pandemic. It can be analyzed as large or as small as the common cold. The healthcare industry is one of the largest industries in Canada, and in Alberta specifically, a research study in 2012 uncovered that hand hygiene compliance is actually as low as 49.7%. That means that almost half of the employees in Alberta Health Services are actually complying with hand hygiene protocols. Currently, in an industry that is overworked, there is nothing reminding healthcare professionals to wash their hands other than a sign by the sink. Bclean is the solution to the worldwide problem that will ensure that no clinical healthcare professional ever forgets to wash their hands again. And it all starts here in Calgary.
In developed countries with sophisticated treatments and technologies, healthcare-associated infections continue to account for complications in 5 to 10% of admissions to hospitals. For example, in the US alone, there are at least 80,000 fatalities each year from healthcare-associated infections. Across all settings, patients can acquire bloodstream infections, surgical site infections, and more. In Europe, healthcare-associated infections cost 16 million extra hospital days and 37,000 attributable deaths. Associated costs are approximately 7 billion euros annually. According to the Joint Commission, hand sanitization failures contribute to healthcare-associated infections that kill nearly 100,000 Americans each year. It also costs U.S. hospitals anywhere between $4 and $29 billion annually.
So here's how it works. Each healthcare worker will be provided with a low-cost bracelet. Each bracelet will include a RFID, a liquid sensing circuit, and an LED light. In addition to the wristband, each clinical room will be provided with a radio frequency sensor. There will be a centralized database which tracks the healthcare worker as they move from patient room to patient room. Once the healthcare worker enters a new room, the light will turn red, indicating that proper hand sanitation needs to be performed. Once proper hand sanitation is performed, the light on the bracelet will instead turn green, which indicates that proper hand sanitation is performed. If the doctor or healthcare worker forgets anything outside the room, like a pen or a client file, there will be a small time delay of 1 minute, which helps compensate for these small errors.
The staff is reminded of this all the time, and then we've also got on wherever we're doing any of our procedures, anything like that, there's a plaque on the wall that says to wash your hands, sanitize, and also on all the walls there for the patients as well. You know, you're so busy with everything else, so is there something else that you really need working in a health, whether it's in a clinic, in a hospital, whichever, in a health industry? They should know, or even if you're working in a restaurant, anything like that, sanitization is key, right?
Has the device been obstructive with your work or anything?
No.
It's been perfect?
It's perfect. It gives me confidence that my hands are clean.
Perfect, thank you very much.
Most welcome.
Accessing hospitals in Alberta is a difficult thing to do, which is why we want to start working with clinics in the Calgary area to help ensure they can provide their patients with safe and reliable care. It is Bclean's goal to improve clinics and the healthcare industry to be a safer, effective, and a more efficient hub for hand sanitation. Calgary clinics are prone to patients with annual contagious illnesses such as the cold and flu. Once we increase Bclean's presence in the clinical industry, we'll be able to make a proposal to our first hospital and provide a tested and heavily researched solution to an industry-wide problem. Calgary is a diverse community that provides access to a variety of family clinics. With that being said, we have already approached clinics who have all replied stating this is a product they believe would add value to their field of work. In each letter, they state that they would be interested in trying a product like Bclean at their office and have committed to being a resource for us throughout the research and all of its developmental stages.
Alright guys, we're super excited about our Bclean device, and now we need your help to make our dream become a reality. If we win the grand prize, we have determined that we will need to spend approximately $15,000 on research and development, which goes into perfecting the technology that goes into the device, as well as the software associated with our devices. Secondly, we have determined that with existing technology already, to manufacture our bracelet with all the parts, it will cost around $20 to make per bracelet. And for each door sensor, it will cost about $75. So a grand total for both equivalent to $95. Now, with that being said, we have 5 clinics and intend to pilot our device if we can create it. So that will cost us approximately $4,000. And that includes the cost for making all the bracelets for all the doctors at the clinics, as well as putting up all the door sensors in all the rooms in the clinics. Now, we hope that you will support Bclean on taking our next steps to making the calorie clinics a safer place to live for you and your family.